So, very good to all of you. Shri Kumarswami Mahavidyalaya Ausa, District Latur, is organized World Record Series 2. Third day of this, and is B Kalaiyarasan sir. So, I am the chief organizer of the series, Honorable Principal M. Ambedkar sir. Welcome the colleagues from my college, Dr. Kalaiyarasan, Dr. Solim, Honorable Praveen Woodley sir, and heartily welcome all the participants. The topic for today's presentation is 7 P's and Healthcare Services. Now this topic is going to present Honorable Dr. B Kalaiyarasan sir, who is an assistant professor serving in the Department of Business Administrations, Dharmamurti Rao Bahadur Kyalwala Kanan Chetti Hindu College, DRBCC Hindu College, Pattabiram, Chennai, Tamilnadu. So with this brief introduction, now I request to you, sir, please start your presentation on the topic 7 P's and Healthcare Services. You are most welcome, sir.
First of all, thank you for the organizer and the principal and the management committee members and everyone. So good evening one and all. On this special occasions, I want to thank everyone because of the proud moment to are conducting. Maybe you are organizing the World Series, so it's you are giving an opportunity. Maybe at the part of the, I also one of the tool in the World Series. That's why I want to thank again. Okay, can I proceed, sir? Yeah, thank you, sir. So is it visible?
Yes, visible.
Yes, sir. Yes, sir. Yes, sir. So myself, Dr. Kalaiyarasan, already you are shared my introductions. So even though I want to share my a little bit profile. So I'm Dr. Kalaiyarasan from Chennai. I'm working in DRBCC Hindu College as assistant professor. Already I shared my experience in the name of marketing research in the before the first part in the 500. So again, you are giving an opportunity for me. So it's a wonderful time. That's why I want to share my thanks to everyone. Okay, thank you so much. Okay, this is about 7 P's and healthcare services. So before enter into the 7 P's and healthcare services, we need to know the background of the services or services marketing. What is services? Why it's important in the present scenario? Like that, we need to go some background about services. Okay, so we are all about know that in the services, everyone using the services from morning to night, using lot of services. Okay, so everyone using the product actually. So product is the combination of goods and services, maybe a tangible and other one intangible. I want to give some more information about tangible and intangible. If you are thinking about in the tangible, maybe it's a structure. If we can buy the product, we can consume the goods, we can touch the goods, we can feel immediately everything. It will happen in the maybe a goods because of the tangible. What about in the intangible? So it may be invisible. There is no structure, but we can able to buy or consume the goods and services, but we can able to realize the benefit little bit later, or it will take some time. So it may be the services. Okay, you can be able to give a lot of example. It may be in another side. So marketing services are achieved through the way of attracting new customers, retaining existing customer, selling them upgraded services, channelizing referral from existing customer. So these are all happen through the way of marketing of services. So what is that services? So if you are going for the example, services are educational services, financial services, professional services, and what else? Healthcare services, hospitality services, not only that, public utility services. So, lot of example in the category of services. Just to see the picture. So here you are seeing a lot of pictures. Maybe it's related to services. It's a restaurant, internet services, dry cleaning, spa, beauty parlor, travel and tourism, food delivery, banking services and courier, and not only that, so space rental, that means it's a rental. Okay, everything connected to the services only. That's why I already said at the time of starting my speech. So from morning to night we are using lot of services. So everyone utilizing services, we go one by one. So there are two parameters involved in my concept. That's why I very much interested in 7Ps and healthcare services. One is GDP and other one health. So what is that GDP? Gross domestic product. So that the revenue generated within the boundaries of maybe our India. And other one health. So
Kind request dear participants. Please unmute.
हाँ तो पहली बार तो यहाँ होगा बढ़िया.
There are 17 goals maybe initiated by UNESCO. The health also one of the goal, maybe the third one. So now everyone wanted to improve the health, or everyone wanted to maintain the same health. So that's why I very much interested in the 7Ps and healthcare services. So coming back to the GDP, so GDP, there is gross domestic product. So services revenue. Think about the services revenue. So in Western countries or European countries, the revenues from the field of service maybe is related to or more than 80 to 90%. Whereas in India, it's related to services or revenue generated within the field of service, it may 30 to 40. So think about the potential. So think about the future may be waiting for us. So that's why all the countries are looking for India, are making us like a market. So because of the population, so because of the technology, because of the education, so because of the women empowerment, like that, lot of reasons are added in the category of that services marketing are grown up. I want to add some more detail. So I want to connect with the healthcare industry and the services sector. So healthcare industry, if we are thinking about the healthcare industry, not only hospital, it connected to all the services, all the facilities. Just to see that the pictures. So hospitals, research center, pharmacy, health insurance, and lab technology, and that means lab facilities, manufacturing of medicine, and manufacturing of all equipments related to the healthcare. But we are focusing hospitals, pharmacy, and lab facilities. So these are very unique, and these are very closely connected with the healthcare services. So other things are connected, but we are focusing on these three only. Hospitals, pharmacy, and lab technology are so these are come under healthcare industry or healthcare services. So thinking back to our 7Ps and healthcare services. So you are all aware about that the 4Ps or 4Ps of marketing or marketing mix. The basic one, product, price, place, and promotions. Now we are adding three more features like people, physical evidence, and the process. So this is about the 7Ps. Now we are connected to the how the 7Ps are connected to the healthcare services. How these 7Ps are connected with the healthcare services. Like that, we need to go one by one. So think about the product. The first one, the product. So if any services or any business run with the help of product only, so they need to provide some product, then only it may attract to the customer. Then only they keep along with the throughout the day with the help of product only. If they are providing product, then only customers are attracted and or buy the product or consume the services. Like in healthcare services also we have product. So the product may be facilities. The product may be a, what are their services? What are the services they provided by the healthcare or pharmacy or lab? It may be their counseling, their advice, their facilities, their infrastructure, everything come under product. Not only that, the pharmacy services, casualty services, emergency services, and ambulance services. That's why I already told that. So facilities provided by the healthcare industry or maybe the hospital, it's come under product. Next one, price. So if product or if services we need to buy, so we need to pay something, then only we can able to buy or consume the goods and services, right? So, but they are using some other words, maybe the charges or fee or consultancy charges, like that they are using lot of words. It may differ from organization to organization. It may differ from hospital to hospitals because of their value-added services, because of their what kind of doctors they have in their hospitals. So because of the medicine, because of the equipments, so everything connected or maybe the calculated the price. So you are all think about maybe the range of different ranges of hospital, different types of medical, that means pharmacy also there. So different types of lab facilities also there. In government hospitals, some of the lab facilities are free to the patients or general people. Some of the lab facilities are, they may given maybe a package. It's available in the private hospitals. So like that they are charging more or sometimes affordable. Sometimes it may be average. So anyway, the price may differ from institution to institution or healthcare to healthcare. That's why I want to convey that. We are moving to next one, that is place. So we need to use or consume the services, they need one place. So we are moving to the one place, maybe the hospital. We are moving to the pharmacy or lab facilities. So it may be in the name of pharmacy or lab facilities or maybe the hospital. Sometimes the healthcare industry come to the home or they reach to the patients because of the critical care or maybe the nature of the disease. So like that healthcare industry also reach to the home or reach to the patients. It's available. So the place may differ. The place may vary because during the COVID, they offer telemedicine. They offer free telephone numbers. If you call to the telephone numbers, they give the ideas. They give suggestions or advice how to use or what are the medicine you're supposed to use. Because we are locked in the, maybe it's like a home arrest, maybe in the lockdown. So at that time, through video conferencing, they are providing a suggestion or they are counseling through video conferencing. At that time, it may be a place. So if we going for detailed manner, maybe in the government hospitals, it starts with a primary health center and taluk level hospital, district level hospital, and state level hospital. Maybe in state level hospital, they call general hospitals. Like in very big hospital, they have all the facilities, all the lab facilities, and they have all the experts of doctors are available in the particular hospital. Everything connected in the particular state level. And not only that, they along with the medical colleges also there, and they along with the research center. So only for research center maybe operating with the help of government or government funded. What about in private hospital? Maybe you start with the clinic, nursing home, multi-speciality hospitals, and very big hospitals like along with the research center, and in private hospital they have along with the medical colleges also there. So these places we are moving to get the treatment. We are moving to get the advice from the doctors or from the healthcare industry. So this is about the place. And promotions. The fourth one is promotion. So if any product or any services to need promotion, with the help of promotion only we need to reach the people. We need to create awareness among the general people. So that's why promotions are very, very essential. In the promotion, there are advertising, personal selling, publicity, and other things also, like we can call it in the name of promotion 6. So advertising, sir, is like a salt. So that's why we need to use it. So we can use it every time. We can use it all the time, but in minimum level. So think about it, without the salt, what will happen? So like that, advertisings are needed for the healthcare industry also, for government as well as private. So during the COVID time, think about what kind of promotions are they done for creating awareness about COVID, creating awareness about safety, hygienic, and how to avoid or in what manner we need to protect through the way of immunity, what kind of food supposed to be eat. Like that, they create a lot of awareness. It's a kind of publicity. So it's a kind of promotions. So that's why there are two classification in the promotions. One is personal and other one impersonal. So connected to the personal, maybe through the person. So it is a powerful and strong medium. It may be called in the name of word of mouth, or it may be a reference. Once the people get involved, or maybe they happy at the end of the treatment, they spread the message among their neighbors and relatives and friends. It's spreading just like the forest fire. So it's a very good, or it may be strong promotions because of that kind of power for the word of mouth. And other one in the usual, traditional, we are using lot of things in the impersonal, like the press release, internet, newspaper, magazine, and digital and social media, lot of things involved in the impersonal. So government hospitals are government doing lot of promotions, like the same COVID or polio or AIDS awareness, and what kind of health facilities are providing in the health government hospitals, everything. So everything connected to the promotion. They make awareness about the facilities provided by the government. At the same time, the private also they make a lot of promotions to make awareness among the common people about their service facilities, about the what kind of experts or doctors available in their hospital or their research center, like that. Like that, they spread message through social media and traditional media. So everything come under promotions. And we need move to the next one, maybe the other three new features. Okay, the first one is people. So people are involved. So people involved in the healthcare services. So one is service provider and service receiver. So service provider, it may be healthcare, or their organization, or their staff, doctor, nurses, ward boy, or lab technicians, pharmacists, and what are the people, or who are the people involved into the healthcare services. So they are come under service provider. And other one, service receiver, maybe a patient or caretaker or common people or general people in the other categories or in the other side. So here we need to remember the characteristics of services. The one is intangibility and the other one inseparability. So here we can add that the characteristics of intangibility. It may be very suitable in the particular people. So one is service provider and the other one service receiver. So they are supposed to connected always. They are supposed to together. Then only the service may happen. That's why. That's why it's a kind of inseparability, always together, and it may be it's not supposed to separable. So if together, then only service happen. And next one, physical evidence. So it's a kind of tangible, it's a visible, maybe a structure. So a lot of physical evidences are for the healthcare and pharmacy and lab facilities are. So that the infrastructure, the building itself is the physical evidence. The hospital building or infrastructure is the physical evidence. So always they park in front of the hospital or their health services, maybe ambulance, and it just you can see that maybe a pharmacy or healthcare industry or maybe a healthcare institution, they mention like that the plus mark, maybe a logo. So we can able to identify that. So there is a health service, there is a pharmacy, like that we can able to understand because of the logo. And not only that, ECC scan, X-ray, and other things are may included in the physical evidence. Not only that, their name, their logo, their tagline, their interior, that color also may influence like the physical evidence. Their hospital or health service providers uniform also connected to the physical evidence. It may be a brand, so it may influence to the people. That's why the physical evidence are very, very important in the services. And we move to next one, process. So what kind of services, what happened actually in the healthcare services, like that we need to analyze that. If you are enter into the hospital, how we get treatment, what are the process involved, what kind of lab facilities are there, what kind of tests are conducted during the treatment, what kind of service, counseling or advices are given by that doctors or nurses or maybe some maybe a psychologist. So like that we need to understand it come under process. It may classify into two. One is outpatient and inpatients. So we shortly know that outpatients are OP. The people are come and get advice or treatment, and they go to home the same day. They are not admitted into ward. What about in the inpatient? They come and see the doctor and get advice based on the nature of the disease or based on the nature of the problem. Then only they are supposed to admit to the ward. And before that, they are taking all the, you are all aware about that, all the tests and everything. So based on the test only, they are supposed to admitted into the normal ward or maybe in the ICU or maybe a special ward. We need to give some special attention or more care in the care to the patient. So because of the nature of the problem, because of the nature of the disease, it's reflected in the test. So these are all happen in the process. Very important is that lab test. So all the facilities, the lab test may be available, maybe a CT scan or master health checkup like that. So it's available, but it may it's not easy for the common people. So in government, they declare that it's available in the hospitals. You're supposed to come and register yourself, but it will take time. But you can able to get all the facilities and you can able to get all the tests in government hospital with the free of cost. So if they provide like that, it may more benefited to the people. It may more benefited to the common people. But it's happened, or sometime it may postpone, or sometime maybe it's not available. Actually, it's not available, the services. We are not blaming anyone. It's available. So maybe some other hospital, that's why. So we are lacking in the technology this way. And we move to the next one. So about the conclusion of the 7 Ps and healthcare services. So now we utilizing all the modern technology. Now we are developing in the healthcare services. So with the help of technology, we are collaborating with foreign countries. And think about the future of the healthcare services. Already it's started actually, robotic process automation, shifting disease burden. Maybe government also giving a lot of policy support, and they give guidelines, and they're releasing incentives also for private and the aided hospitals. And that during the COVID period, central government also announced Atmanirbhar Bharat Abhiyan. It's a kind of self-relying India. So central government announced, or central government allotted the fund. It may be more than 1,000 crore in particular Atmanirbhar Bharat Abhiyan. And state and the central government also increasing insurance coverages, and also emergence of telemedicine. Already we seen that during the COVID, already it's a practice. So telemedicine over the phone, or over the WhatsApp, or video conferencing, already it's a practiced one. It's available now. And so government to increasing medical infrastructure. So government increasing medical infrastructure in rural areas. Maybe in the primary health centers also increasing that all the facilities. So that's why encouraging. Okay, whatever may be the development, whatever may be the technology be adopted. So we supposed to give care. We may supposed to adopt the innovation. We need to some more effort in the modern technology. So why it's all needed? So the very much essential is we need to save the life. That's why. So it's a care and innovation and modern technology, but very important is very empathy. It's with empathy. So then only, so because in the general people are common people are they simply trust with the people, they simply trust with the healthcare people, they trust the people like a god. So doctors as a god, like that they're thinking about. So simply they surrender. So whatever may be the technology, whatever may be the services or encouragement from the government, we need to use some more priority through the care, innovation, and modern technology, because we need to save their lives with the empathy. So like that, I want to conclude that. So thank you so much for everyone. So this is I concluded my speech. So if any clarifications or if queries, anyone you can ask me. I'm waiting for that. Thank you so much.
Very much, sir, for wonderful presentation. Now I request all dear participants, if you have any query, please come ahead. You ask, sir will answer. Dear participants. I mean, everything's are clarified through your speech, sir. Now I request the chief organizer of the series, Honorable Principal M. Ambedkar, sir. Sir, please welcome and have concluding words for today's session. Please welcome, sir. Unmute yourself, sir. Sir, please unmute. You are not audible. Yes, sir.
Thank you, sir. Thank you so much for everyone for giving the opportunity for me. So it's a good thing, sir. It's a nice one. Thank you so much for the principal and organizer and all the participants. Thank you so much, sir, once again.
Sir, please wait for 2 minutes for formal vote of thanks. Thank you, sir. Now I move towards the vote of thanks. Shri Kumarswami Mahavidyalaya Ausa, District Latur, as we know, organized World Record Series 2. Today we have completed 203rd session of the long World Record Series 2. The topic for today's presentation was the 7 P's and healthcare services which have been presented by Honorable Kalaiyarasan very clearly, sincerely, where sir have explained all those services, physical services, event process, promotions, product, price, place, people. What do the 7 P's stands for? What are the 7 P's in healthcare? What are the 7 P's of services in marketing? Different characteristics of the services. At last, sir have explained how this modern technology helps to save our life. So, cover in your future, sir. You explain all those things brought in front of us sincerely. So I'm very, very thankful to you for being with us and paying your valuable time to us. Really, it was very informative, sir. So I'm again. Then I thanks to the chief organizer of the series, Honorable Principal M. Ambedkar, sir. I thanks my college, Sanjay Kale, sir, Dr. Nita Dole, madam, vocational supervisor, Praveen Udge, and others. And heartily thanks all those dear participants who joined the series. So thanks to you all in the project which is given in the question of the chief today's session is over. Once again, I thank it's very essential for today's session for us. Thank you very much.
Thank you, sir. Thank you.